Have you ever stood up from your chair and felt the world tilt sideways? Have you reached for the staircase railing with both hands? Not because you wanted to, but because you had to. Have you felt your legs grow heavy and uncertain, as if they no longer belong to you? If you answered yes to any of these questions, then what I am about to tell you will change everything you thought you knew about your health. Because the harsh truth is this: the medication sitting in your bathroom cabinet right now, the pills you trust and take every single day, may be the silent culprit slowly robbing you of your balance, your strength, and ultimately your independence. You thought they were helping you. You thought they were keeping you safe. But here is the wake-up call. Nobody warned you about four common types of medication are creating insidious harm to your legs, your coordination, and your ability to stand firm on your own 2 feet. And the most dangerous part, this damage happens so gradually, so quietly, that by the time you notice the symptoms, the risk of a devastating fall has already multiplied. I am here today to reveal the four prescription medications that are undermining your leg strength and balance without you realizing it. I will show you how they work, why they are so dangerous for adults over 60, and most importantly, what you can do right now to protect yourself before it is too late. But before we continue, I want to ask you something personal. If someone you love is facing a health challenge right now, if they are struggling with pain, weakness, or fear about their future, type the number 1 in the comments below or share their name. We will keep them in our prayers and healing thoughts. This video is for you, and it is for them, because the information you are about to receive could save a life. Now let me tell you exactly what is happening inside your body when you take these medications, and why your legs are paying the price. Medication 1: sleep and anti-anxiety drugs. You have been told that sleep medications and anti-anxiety pills are safe solutions for your restless nights and worried-out days. Names like lorazepam, diazepam, alprazolam, and zolpidem are prescribed millions of times every year. Doctors hand them out like candy, promising relief from insomnia and stress. They work quickly, they calm you down, and they help you drift off to sleep. What could possibly be wrong with that? Here is the harsh truth they did not tell you. These medications work by suppressing your central nervous system. They slow down the communication between your brain and your muscles. While this helps you relax and fall asleep, it also dulls your reflexes, weakens your muscle coordination, and disrupts your sense of balance. Your brain stops sending clear, rapid signals to your legs. Your muscles lose their ability to react quickly when you stumble or shift your weight. Think of it this way: your body is like a sophisticated alarm system. Your brain constantly monitors your position, adjusts your posture, and keeps you upright. Sleep medications are like disconnecting critical wires in that system. The alarms still exist, but they no longer work fast enough to protect you. By the time your brain realizes you are losing balance, your legs have already failed to catch you, and the insidious harm goes deeper. These drugs also cause something called residual sedation, meaning they do not fully leave your system by morning. You wake up feeling groggy, your legs feel sluggish, and your coordination is still impaired. Studies have shown that people taking these medications have a 50% higher risk of falls and fractures. Every pill you take is like adding weight to your ankles while asking you to walk a tightrope. Let me paint you a picture of what this looks like in real life. You take your sleeping pill at night, you sleep reasonably well, but when you wake up at 3 a.m. to use the bathroom, your legs do not respond the way they should. Your balance is off, you feel dizzy. You reach for the wall, but your hand misses, and in that split second, you fall. Your hip fractures, your independence shatters. This is not a rare scenario. This is happening to thousands of seniors every single day. The pain is immediate. The recovery is long and agonizing. And many people never regain their full mobility again. The silent culprit was not age. It was the medication they trusted. Let me tell you about Margaret, a 67-year-old woman I met during a consultation. She had been taking zolpidem for 5 years to manage her insomnia. At first, it seemed like a miracle. She fell asleep within 20 minutes and slept through most of the night. But over time, she noticed something disturbing. Every morning, she felt foggy and unsteady. Her legs felt weak when she walked to the kitchen. She stumbled occasionally but blamed it on her age. One night, Margaret woke up at 2 a.m. feeling thirsty. She got out of bed, still under the influence of the medication, and walked toward the bathroom. Her legs buckled. She fell hard, fracturing her pelvis and her left wrist. She spent 6 weeks in the hospital and another 3 months in rehabilitation. When I reviewed her medications, the connection was undeniable. The sleeping pill she trusted had been slowly destroying her balance and coordination for years. What broke my heart most was when Margaret told me, "I thought I was just getting old. I had no idea my medication was doing this to me." Today, Margaret has stopped taking Zolpidem. She uses cognitive behavioral therapy for sleep and practices balance exercises daily. Her legs are stronger, her coordination has improved, and she has not fallen since. But she lost months of her life and suffered tremendous pain because nobody warned her about the risks. If you have been taking sleep or anxiety medications for months or years, your legs are already weaker than they should be. Your reaction time is slower, your risk of falling has multiplied, and every additional pill you take pushes you closer to the edge. But sleep medications are not the only danger hiding in your medicine cabinet. In fact, the next medication I'm about to reveal is even more common, and the insidious harm it causes to your balance and leg strength is something most doctors never explain. If you are taking medication for high blood pressure, you need to hear this next part very carefully. Medication. 2. Blood pressure medications. Blood pressure medications are essential. They protect your heart, prevent strokes, and keep your cardiovascular system stable. You have been told they are life-saving, and in many ways they are. Millions of people over 60 take medications like amlodipine, lisinopril, losartan, or hydrochlorothiazide every single day. They lower your blood pressure numbers, and your doctor celebrates the results. But here is the wake-up call. Nobody mentioned these medications can cause a dangerous drop in blood pressure when you stand up. This is called orthostatic hypotension, and it is one of the leading causes of dizziness, lightheadedness, and falls in older adults. Let me explain how this works. When you sit or lie down, your blood pressure is stable, but when you stand up quickly, your body needs to adjust the blood flow to keep your brain and legs functioning properly. Blood pressure medications interfere with this adjustment. Your blood pressure drops suddenly. Your brain does not receive enough oxygen for a few critical seconds. You feel dizzy, your vision blurs, your legs buckle, and before you know it, you are on the ground. This is not a minor side effect. This is a silent culprit destroying your ability to move safely through your own home. Every time you stand up from a chair, every time you get out of bed, every time you climb stairs, you are at risk. And the worst part, many people think this dizziness is just normal aging. They accept it. They live with it. They do not realize their medication is the hidden cause. Additionally, some blood pressure medications, especially diuretics, cause dehydration and deplete essential minerals like potassium and magnesium. Without these minerals, your muscles cramp, your legs feel heavy, and your coordination deteriorates. You might experience night cramps that wake you up in pain, or sudden weakness in your legs during the day. The insidious harm accumulates slowly, but the consequences are devastating. Imagine this: you wake up in the morning feeling fine. You take your blood pressure pill with breakfast. An hour later, you stand up to walk to the kitchen. Suddenly, the room spins, your legs feel weak. You grab the counter, but your grip fails. You fall and hit your head. You are rushed to the hospital with a concussion and a fractured wrist. This happens every single day to people who had no idea their blood pressure medication was undermining their balance. The harsh truth is that protecting your heart should not come at the cost of your legs and your independence. But without proper management, that is exactly what happens. Robert was a 72-year-old retired engineer who had been managing his high blood pressure with amlodipine for 8 years. His blood pressure readings were excellent during his doctor visits. But at home, Robert was experiencing something he never mentioned to his physician. Every time he stood up from his recliner, He felt a wave of dizziness wash over him. His vision would darken for a few seconds. His legs felt unsteady. He started holding on to furniture as he moved through his house. One afternoon, Robert stood up to answer the phone. The dizziness hit harder than usual. His legs gave out completely. He fell backward, hitting his head on the coffee table. His wife found him unconscious on the living room floor. He was rushed to the emergency room with a severe concussion and bleeding in his brain. When the medical team reviewed his medications, they discovered that his blood pressure was dropping dangerously low whenever he stood up. The medication that was protecting his heart was simultaneously putting his brain and his independence at risk. After adjusting his medication to a different class of blood pressure drugs and teaching him proper standing techniques, Robert regained his stability. He learned to stand slowly, to hydrate properly, and to recognize the warning signs before they became dangerous. To date, Robert tells everyone he meets about his experience. He says, "I wish someone had told me that dizziness is not normal. I wish I had known my medication could do this. I could have prevented my fall and saved myself months of recovery." His story is a powerful reminder that the medications we trust can become silent culprits if we do not understand their full effects. If you experience dizziness when standing, if your legs feel unsteady after taking your medication, if you have fallen even once in the past year, your blood pressure drugs may be putting you at serious risk. But blood pressure medications are not the only pills weakening your legs and increasing your fall risk. The next medication on this list is something millions of people take without a second thought, believing it is completely harmless. If you have ever reached for an over-the-counter painkiller to ease your aching knees or sore back, you need to pay close attention to what I am about to reveal. Medication 3, nonsteroidal anti-inflammatory drugs, NSAIDs. You have been told that ibuprofen, naproxen, and other NSAIDs are safe, effective painkillers. You take them for joint pain, back pain, headaches, and inflammation. They are available over the counter, so they must be harmless, right? Millions of people pop these pills daily without thinking twice. Here is the harsh truth: long-term use of NSAIDs causes insidious harm to your muscles, joints, and overall mobility. These medications work by blocking inflammation, but they also interfere with the natural repair process your body uses to heal damaged tissues. Every time you take an NSAID, you are not just reducing pain, you are also slowing down the recovery of your cartilage, tendons, and muscles. Over months and years, this leads to weakened joint structures. Your knees become less stable. Your ankles lose their resilience. Your ligaments do not hold as firmly as they should. And when your joints are weak, your balance suffers. You become more prone to twisting an ankle, buckling a knee, or losing your footing on uneven ground. But the damage does not stop there. NSAIDs also increase the risk of fluid retention and high blood pressure, which can worsen dizziness and instability. They interfere with kidney function, leading to dehydration and electrolyte imbalances that make your legs feel heavy and uncoordinated. And in some cases, they cause gastrointestinal bleeding, which leads to anemia, weakness, and fatigue, further compromising your ability to move safely. The silent culprit here is the cumulative effect. One pill does not cause a problem, but years of daily use. That creates a perfect storm of joint instability, muscle weakness, and balance problems that increase your fall risk dramatically. Let me give you a real-life example. You have been taking ibuprofen every day for 3 years to manage your knee pain. At first, it helped, but gradually, you notice your knees feel less stable. You have trouble climbing stairs. You feel off balance when walking on uneven surfaces. One day, you step off a curb, your knee gives out, and you fall hard onto the pavement. You fracture your wrist and injure your shoulder. The irony: you were taking the medication to protect your joints, but it was actually making them weaker and less reliable. The insidious harm happened so slowly that you never connected the dots. And now your independence is at risk. Linda was a 69-year-old woman who loved gardening and walking in her neighborhood. She had been dealing with chronic knee pain for years and relied on ibuprofen to get through her daily activities. She took 400 milligrams 3 times a day, every single day, for nearly 4 years. Her doctor never questioned it because it was over the counter and seemed harmless. But Linda started noticing changes. Her knees felt unstable when she walked downhill. She had difficulty getting up from her gardening stool. Her ankles felt weak, and she twisted them more easily than before. One morning, while walking her dog, she stepped on a small rock. Her ankle rolled, her knee buckled, and she fell hard onto the sidewalk. She broke her wrist in 2 places and tore ligaments in her ankle. During her recovery, a physical therapist asked about her medications. When Linda mentioned her daily ibuprofen use, the therapist explained the connection. The medication she had been taking to manage her pain had been slowly weakening her joint structures and making her more vulnerable to injury. Linda was devastated. She had no idea that something so common and accessible could cause such harm. Today, Linda has stopped taking NSAIDs regularly. She uses targeted physical therapy, gentle stretching, and natural anti-inflammatory foods like turmeric and ginger to manage her pain. Her joints have stabilized, her balance has improved, and she has not fallen since. But she carries the scars of that fall, both physical and emotional, as a reminder of the hidden dangers lurking in her medicine cabinet. If you have been taking NSAIDs regularly for months or years, your joints and muscles are not as strong as they should be. Your balance is compromised. Your risk of falling has increased, and every additional dose pushes you closer to a dangerous fall. But pain medications are not the only over-the-counter drugs silently undermining your balance and leg strength. The next medication I am about to reveal is sitting in almost every household medicine cabinet, and most people have no idea how dangerous it can be for older adults. If you have ever taken an antihistamine for allergies or to help you sleep, what I am about to tell you will shock you. Medication 4. First-generation antihistamines. You have been told that antihistamines like diphenhydramine, found in Benadryl and many over-the-counter sleep aids, are safe and effective. They relieve allergies, help you fall asleep, and seem completely harmless. They have been around for decades. Your parents took them, you take them. What could possibly be wrong? Here is the wake-up call. First-generation antihistamines cause severe drowsiness, impair coordination, and significantly increase fall risk in older adults. These medications cross into your brain and interfere with multiple neurotransmitters, not just histamine. They block acetylcholine, a critical chemical your brain needs for balance, muscle control, and quick reflexes. When you take these medications, your brain slows down. Your reaction time increases, your muscles do not respond as quickly as they should, your sense of balance becomes unreliable. And because these drugs stay in your system for many hours, you remain impaired long after you think the medication has worn off. Studies have shown that older adults who take first-generation antihistamines have a 40% higher risk of falls and fractures. The sedative effect is so strong that it mimics the impairment caused by alcohol. Imagine trying to walk a straight line after having several drinks. That is what your brain and legs are dealing with when you take these medications. And the insidious harm goes even deeper. These drugs interfere with your sleep architecture, reducing the quality of your rest. You might fall asleep faster, but your body does not enter the deep, restorative sleep stages it needs to repair muscles and consolidate balance reflexes. So you wake up feeling groggy, your legs feel weak, and your coordination is still compromised. Picture this: you take a Benadryl before bed to help with your allergies. You fall asleep quickly. But when you wake up at 2 a.m. to use the bathroom, you are still sedated, your legs feel unsteady, your vision is blurry, you misjudge the distance to the bathroom door. You trip over the edge of the rug, you fall and break your hip. This exact scenario happens thousands of times every year. The harsh truth is that a medication you thought was harmless has become a silent culprit stealing your balance, your coordination, and your independence. And because it is available over the counter, most people never question its safety. Thomas was a 71-year-old man who suffered from seasonal allergies and occasional insomnia. He had been taking diphenhydramine almost nightly for more than 6 years. He considered it safe because it was available without a prescription and had been recommended by his pharmacist years ago. But Thomas started noticing troubling symptoms. He felt mentally foggy during the day. His legs felt heavy and uncoordinated. He had difficulty focusing on conversations and often forgot where he placed his keys or glasses. One evening, Thomas took his usual dose of diphenhydramine around 9 p.m. He woke up around midnight feeling thirsty and decided to get a glass of water. As he walked down the hallway, his legs felt like they were moving through thick mud. His vision was blurred. He reached for the wall to steady himself, but his hand-eye coordination was so impaired that he missed. He stumbled, fell forward, and crashed into the bathroom door frame. He broke 3 ribs and suffered a severe shoulder injury. In the hospital, a geriatric specialist reviewed his medications and immediately flagged the diphenhydramine. She explained that first-generation antihistamines are particularly dangerous for older adults because they impair cognitive function, balance, and coordination for up to 12 hours after taking them. Thomas was shocked. He had no idea that something so common could be so dangerous. After his recovery, Thomas switched to a second-generation antihistamine that does not cross the blood-brain barrier and does not cause sedation. He also implemented better sleep hygiene practices and began taking magnesium supplements to improve his natural sleep quality. Within weeks, his mental clarity returned. His legs felt stronger and more responsive. His coordination improved dramatically, and most importantly, he regained his confidence in moving through his home safely. Thomas now shares his story with everyone he knows. He says, "I trusted that medication because it was easy to buy and everyone uses it, but it was slowly stealing my independence, and I did not even realize it until I ended up in the hospital." His experience is a powerful wake-up call for anyone who relies on these medications without understanding their true risks. If you have been taking antihistamines regularly, especially at night, your balance and leg strength are already compromised. Your reaction time is slower. Your fall risk is elevated, and every additional dose increases the danger. Here is the good news. Though you are not trapped, you are not doomed to live with weak legs, poor balance, and constant fear of falling. There are proven, effective alternatives that can help you regain your strength, restore your balance, and protect your independence without relying on dangerous medications. Let me give you 4 powerful solutions that address the root causes of instability and fall risk. Solution 1: medication review with a pharmacist or doctor. The first and most critical step is to gather every single medication you are currently taking, prescription and over-the-counter, and bring them to your pharmacist or doctor for a comprehensive medication review. Many falls and balance problems are caused by interactions between multiple drugs or by medications that are no longer necessary. A trained pharmacist can identify which drugs are increasing your fall risk and suggest safer alternatives. In many cases, doses can be adjusted, medications can be switched, or unnecessary pills can be eliminated entirely. This simple step has been shown to reduce fall risk by up to 30%. Your independence is worth a 15-minute conversation. I have seen this transformation firsthand with countless patients. One woman named Patricia came to me taking 11 different medications. She was experiencing severe dizziness, leg weakness, and had fallen twice in 6 months. After a thorough medication review, we identified 4 medications that were contributing to her symptoms. We eliminated 2, adjusted the doses of 2 others, and within 4 weeks, Patricia's balance improved dramatically. She told me, "I feel like I got my life back. I did not realize how much those pills were dragging me down." Solution 2: daily balance training. Your legs are designed to keep you upright, but like any system, they need regular practice to stay strong and coordinated. One of the most effective exercises you can do is single leg standing. Here is how it works. Stand near a sturdy counter or wall for safety. Lift one foot off the ground and balance on the other leg for as long as you can, aiming for 30 to 60 seconds. Then switch legs. Do this for 3 minutes every day. This simple exercise strengthens the small stabilizing muscles in your ankles, knees, and hips. It improves your proprioception, which is your body's ability to sense its position in space, and it directly reduces your fall risk by training your legs to react quickly when you lose balance. Within just a few weeks, you will notice firmer steps, better coordination, and greater confidence in your movements. I recommend this exercise to every patient over 60, and the results are remarkable. One man named David, who is 68 years old, started doing single leg balance training after experiencing several near falls. He was skeptical at first, but after just 3 weeks of daily practice, he noticed a significant difference. He told me, "I feel more solid on my feet. I do not worry about tripping anymore. My legs feel strong and responsive again." Balance training works because it directly addresses the weakness that medications create. Solution 3, proper hydration. After blood pressure, medication. If you take blood pressure medications, one of the simplest ways to reduce dizziness and instability is to drink water properly. After taking your medication, sit down and slowly sip a full glass of warm water over the next 10 to 15 minutes. This helps your body adjust to the medication without causing a sudden drop in blood pressure when you stand up. Additionally, avoid standing up quickly. When you rise from a sitting or lying position, do it in stages. Sit on the edge of the bed or chair for a few seconds, let your body stabilize, and then stand slowly. This gives your cardiovascular system time to adjust and prevents the dizziness that leads to falls. I taught this technique to a patient named Susan, who had been experiencing severe dizziness every morning after taking her blood pressure medication. She was terrified of falling and had started avoiding activities she loved. After implementing the slow hydration and gradual standing technique, her dizziness decreased by more than 80%. She told me, "It is such a simple change, but it has made a world of difference. I feel safe in my own home again." Solution 4, magnesium supplementation. Instead of relying on sleep medications or NSAIDs, consider supplementing with magnesium citrate or magnesium glycinate. Magnesium is a natural muscle relaxant that reduces cramping, improves sleep quality, and supports healthy nerve function. Many older adults are deficient in magnesium, which contributes to night cramps, muscle weakness, and poor coordination. Taking 300 to 400 milligrams of magnesium before bed can help you sleep more soundly, reduce leg cramps, and improve overall muscle tone without the dangerous side effects of sedatives or painkillers. Always consult your doctor before starting any supplement, especially if you are on other medications. One of my patients, a 70-year-old woman named Joyce, had been suffering from terrible leg cramps at night for years. She was taking both a sleep medication and ibuprofen to manage the pain. After switching to magnesium glycinate and implementing good sleep hygiene, her cramps disappeared within 2 weeks. She stopped needing the sleep medication entirely, and her balance and coordination improved significantly. She told me, "I wish I had known about this years ago. I suffered for so long when the solution was this simple." If you have made it this far, I know you care deeply about your health and your independence. And I want you to hear this truth clearly. Ing is not about giving up. It is not about accepting weakness, pain, or fear of falling as inevitable. Aging is about choosing wisdom. It is about making smarter decisions today that protect your strength, your balance, and your freedom tomorrow. The medications we have discussed today are not inherently evil. But when used without caution, when taken for too long, or when combined without proper oversight, they become silent culprits that steal your leg strength and increase your fall risk. The good news is that you now have the knowledge to take action. You know what to look for. You know which medications to question, and you know the alternatives that can restore your balance and protect your independence. The stories I have shared with you today are real. Margaret, Robert, Linda, Thomas, Patricia, David, Susan, and Joyce are real people who suffered real consequences from medications they trusted. But they are also proof that change is possible. They took action, they made different choices, and they regained their strength, their balance, and their independence. You can do the same. I want you to understand something important. Every single fall that happens because of medication side effects is preventable. Every broken hip, every fractured wrist, every concussion, every loss of independence that results from medication-induced instability did not have to happen. The information exists. The alternatives exist. The solutions exist. What has been missing is awareness. And that is why I created this video, to give you that awareness, to give you that wake-up call, to give you the power to protect yourself. Now, I want to ask you to do 3 things. First, tell me in the comments below, which of these 4 medications are you currently taking, and what change will you commit to making this week? Will you schedule a medication review? Will you start balance training? Will you try magnesium instead of a sleep pill? Share your commitment below. Let us build a community of people who refuse to surrender their independence without a fight. When you share your commitment, you are not just helping yourself. You are inspiring others to take action too. You are creating accountability. You are building momentum. And you are joining a movement of people who are choosing wisdom over complacency. Second, if this video opened your eyes to a danger you did not know existed, hit the like button. It helps the algorithm show this wake-up call to more people who need it. Your single click could save someone from a devastating fall. Think about the people in your life who are taking these medications right now. Your parents, your grandparents, your friends, your neighbors. By liking and sharing this video, you are giving them the gift of knowledge. You are potentially saving them from months of pain and recovery. You are protecting their independence. That is the power of one simple action. Third, subscribe to this channel and turn on the notification bell, because this is just the beginning. We are here to give you the wake-up calls your doctors are not providing. We are here to reveal the hidden truths about medications, foods, and habits that are silently undermining your health. And we are here to empower you with solutions that work. Every week, we publish new content designed to protect your strength, your mobility, and your independence. We cover topics that matter. We tell you the truth that others are afraid to share. And we give you practical, actionable strategies that you can implement immediately. Never forget that your independence is carried by your legs. Protect them, strengthen them, honor them, because the moment you lose your ability to stand firm on your own 2 feet is the moment your freedom begins to slip away. Your legs carry you through life. They take you to the places you love. They allow you to care for yourself. They give you dignity and autonomy. They are not just body parts. They are the foundation of your independence, and they deserve your attention, your care, and your protection. I want to leave you with one final thought. The medications in your cabinet right now are either helping you or hurting you. There is no neutral ground. If you are taking any of the 4 medications we discussed today, you owe it to yourself to take action. Schedule that medication review. Start that balance training. Implement those hydration strategies. Try that magnesium supplement. Do not wait until after you fall. Do not wait until after you lose your independence. Do not wait until it is too late. Act now. Protect yourself now. Reclaim your strength now. This video is for educational purposes only and is not intended as medical advice. Always consult your doctor before making any changes to your medications or treatment plan. But do not let that disclaimer stop you from asking questions, seeking answers, and advocating for your own health. You have the right to understand what you are putting into your body. You have the right to know the risks. You have the right to explore safer alternatives. And you have the right to make informed decisions about your own care. Thank you for watching. Thank you for caring about your health. Thank you for being part of this community. Now go take action. Your legs are counting on you.